Hey everyone, welcome back. Today we're going to talk about something that is really underappreciated in surgical training, and that's the role of the mind in cancer. And before you click away thinking this is some kind of feel-good fluff piece, stick with me. This stuff is surprisingly powerful, like actually changes outcomes kind of powerful. You see, as cancer surgeons, we spend a lot of time obsessing over tumor biology, surgical margins, and treatment protocols. Which you know is fair because that's literally our job. But understanding what's going on psychologically with our patients is just as critical. So let's get into the basics of psycho-oncology. Now, before we dive in, this video is based on a really great article from the Insights section over at www.thesurgeonbook.com. The article was written by Dr. Priyanka Baweja, who's an adult psychiatrist at Mercy Clinic Behavioral Health in Rogers, Arkansas, and Dr. I hope I don't butcher this name. Prag Thirunavukarasu, a surgical oncologist and clinical associate professor of surgery at Methodist University Cape Fear Valley Health School of Medicine. The full article is linked below, for those of you who still like to read instead of watching videos like this. Alright, so what exactly is psycho-oncology? Simply put, it's the subspecialty that looks at all aspects of the mind in the context of cancer. It's where oncology and mental health overlap. And when you break it down, there are really three main areas we're talking about here. First, psychological factors in carcinogenesis. In other words, the role of the mind in the development of cancer. That's one area of study, a fascinating area in psychosomatic medicine, and I mean genuinely fascinating. But here's the reality. For those of us seeing patients who already have cancer, this area is a bit like learning about how earthquakes form when the building is already shaking. Interesting? Sure. Immediately useful? Less so. Second, the psychological effects of a cancer. This is the big one for us. How does someone's mind respond to being told they have cancer? How do they adjust through treatment? This is the aspect of psycho-oncology that's most relevant to surgical oncologists. And third is about mental health conditions in cancer patients. This area of study primarily falls under the purview of psychiatrists. But that doesn't mean we get to ignore it. We're often the ones who notice it first. So to summarize, psycho-oncology is a field of medicine that deals with all aspects of mental health in the context of cancer. It comprises three main areas of study. First, psychological factors in carcinogenesis. Second, the psychological effects of cancer, that is, how cancer affects the mind. This is the one that should keep surgical oncologists up at night. Well, metaphorically. You're already up at night for other reasons. And third, management of psychiatric diagnoses in cancer patients. So that's it for this short video, folks. We'll be talking more about this in upcoming videos. So hit subscribe if you haven't already, and we'll see you next time. Take care of yourselves and your patients, in that order, because you can't pour from an empty cup or perform a Whipple on 3 hours of sleep. Actually, scratch that, you probably can, but you shouldn't have to. Bye now.